Hello, my name is Eric Tridas, and I am a developmental and behavioral pediatrician from Florida. What we talked about today during the conference was children that present with problems with attention, anxiety, and dyslexia, and how difficult it is to separate them. In looking at our patients, we use the model of the developmental web, which is focusing on the impairment. And we measure impairment in their work, their behavior, and social relationships, and their health. A child that typically presents with dyslexia, for example, has a higher likelihood of having other problems. ADHD and dyslexia happen very often together, and anxiety happens in about 1/3 of the children that have ADHD. So it's very common to have these type of problems clustered together. And unfortunately, the way that we look at the children is, do they have dyslexia, or do they have ADHD, or do they have anxiety? And the problem is that they have a combination of all of them. So they aggravate one another and they interact with one another, but they have to be managed differently. With dyslexia, the first step is to ensure that we assess the components that are affecting reading. And we can look at problems with word attack skills, with fluency, the ability to recognize the letters and their sounds and to put them together into words, the capacity to recognize words rapidly and accurately, and the ability to read with good prosody, with good intonation that will lead to good comprehension. When we're talking about attention problems, we're talking about inattention, we're talking about impulsivity, we're talking about hyperactivity. Now, not every child is impulsive or hyperactive, but the inattention is a common problem to all of them. And the issue has to do more with how they control that function, which is essential for us to be able to develop good word attack skills. It is essential for us to be able to follow instructions and to focus on the task at hand. Anxiety, on the other hand, is defined as excessive worrying that is difficult to control, apprehension about upcoming events, feeling restless or nervous, keyed up, on edge. It can cause irritability. It can cause problems with sleep. And it can cause problems with memory and attention also. So the symptoms can mimic what we see with ADHD too. The child with anxiety may draw a blank when they take a test, or they may withdraw socially. We may see an impact behaviorally because they tend to be very irritable, but that irritability is limited to the home environment. So we often talk to them about our street angels and our house devils because the parents are the recipients of that irritability and that behavior. But if you think about it, when you have a problem with reading and you have a problem concentrating, and on top of that you're so nervous that you may draw a blank, then you really have a combination of factors that are significantly interfering with your capacity to do your work on a day-to-day basis. If you're forgetful about what you were told, or if you do things without thinking, or if you're so tense and on edge that you may overreact, your behavior can be affected dramatically, which in turn is going to cause problems with the adults and with the children that you relate to. Sometimes the anxious children tend to withdraw, so they don't interact with the other children, they keep to themselves, or sometimes they're so worried about following the rules that the other kids get upset because this child is constantly saying, we can't do that, we can't do the other. I joke around, I said, it's like playing with your grandmother, they don't let you do anything. It really has an impact on social relationships. In addition, when you're very anxious, you can have some medical symptoms associated with it. You not only may have problems falling and or staying asleep, but you may have chronic headaches, chronic stomach aches. People tell you I have a tension headache or I have a nervous stomach. Some kids, when they have tests, they have diarrhea, they have to be getting out of the classroom to go to the bathroom because you're so nervous, they may throw up. So we can see some physical symptoms as a result of the anxiety. The important thing is to identify how is it that these three different problems impact what we see: the child's work, the child's behavior and social relationships, and the child's health. So for example, if you have dyslexia, ADHD, and anxiety, academically, you may have obviously problems with reading and writing, because dyslexia has a dramatic impact on that. If you can't read, writing is going to be a problem, particularly spelling, because it depends on your capacity to put sounds together to make words. If you are not attentive, you may not be attuned to the actual sounds of the words, or you may make careless mistakes. Sometimes when you're very anxious, you are so afraid of doing poorly or embarrassing yourself that you don't practice. You shut down, and if you don't practice, you're not going to improve. It can have also a significant impact on your comprehension, because when you get so nervous and you're so worried about how you're doing, or am I going to be able to do this, you're not thinking about what you're doing. So you may be going through the motions, but you're not thinking about the content of the work that you're reading. Behaviorally, a child with dyslexia may avoid tasks that they find difficult or embarrassing, and that's very common. So they may not, do some of the work, and it may be perceived as defiance. The child with ADHD can be disruptive. It, again, may not do as he was told because he kind of got sidetracked or forgot about it, or because he does things without thinking. An anxious child may either blend with the wallpaper and act like if he's not there, or may be so irritable as to have problems. At times they can have very severe tantrums and can even get aggressive. Medically, they may get a heart rate, or feel that their heart is beating very fast. They may get stomach problems, as I said before, sleep problems. So we can see a lot of those areas there. The treatment of these problems involves appropriate reading instruction, having a structured, systematic approach to reading that uses evidence-based, that it provides directed reading and supervised reading to improve the fluency, and that provides a good foundation for phonological processing to really facilitate the word attack skills and spelling. But it will require a lot of practice, a lot of supervision, and the method should be structured and slowly paced and multisensory. The see, hear, do approach under the supervision of someone that has the proper training. We may also see the teacher providing instructions in a way that may be easier for the child with an attention problem. Maybe not giving long instructions, requesting feedback. What did I just say? What are you going to do? Providing a lot of positive reinforcement. Thank you, you did it when I asked you to do it. Boy, I only said it once and you did it. Which is pinpointing the behavior that you want to bring about, which is compliance. Compliance is defined as doing what you were told when you were told. And if you focus on that behavior, as opposed to just focusing on punishing the child for not doing what they were told, you will get better results, and that's what research has shown. The anxious child, having a schedule which will bring predictability will be of help. Making sure that they have the skills to perform the tasks that you're asking them to do, so the level of anxiety will go down. And providing them with strategies like cognitive behavior therapy to help them manage their anxiety. Those strategies involve changing the way that you think about how you feel. Those strategies help you relax, help you find a way of dealing with situations that are particularly difficult or scary for you, kind of becoming desensitized to them, working on relaxation techniques that allow you to not have those body symptoms like a fast heart rate or sweaty palms or breathing difficulty. They also provide you with training on how to think about how you're feeling. to change that. So it's really working on a change in the perspective to give you control of the symptoms. And medication sometimes can be effective in the management of the symptoms. With ADHD, we use stimulant medications and sometimes non-stimulants. And if needed, in anxiety sometimes we can use medications called SSRIs. Environmental accommodations, a lot of structure, a lot of consistency will be also very helpful because it adds predictability to the child's life. And that predictability brings security and also gives you clear expectations. So in essence, that's what we try to do. Explain why things are happening, describe the problems, how they affect the clinical presentation, how do they cause impairment, and then formulate a plan of management that will address the learning problem, the behavioral and emotional problems, and if needed, manage it medically.